Hello everyone, welcome to Pediatrics by Dr. Anand. Such a beautiful day today. Today in this segment, we're going to talk about pediatric nursing, important questions. Before starting any segment, we always have a quote. And what is the quote for today? The quote for today is this beautiful quote. It's nothing but motivation. Motivation plays a very important role in life. Motivation, motivation, motivation. So most importantly, remember your attitude plays a very important role. Goals in life are so beautiful. Success is so amazing. Idea is needed to have a success, and support system of your friends and a good performance plays a very important role in this whole story. Main thing is what? Main thing is motivation. We always say that you will not always be motivated, so you must learn to be disciplined. You will not always be motivated, so you must learn to be disciplined. So motivation is really important. Okay, the first question we have is a beautiful, very easy question. Identify the conditions shown in the image: tetralogy of Fallot, tricuspid atresia, atrial septal defect, and ventricular septal defect. I think this looks like a boot-shaped heart. So where do you see boot-shaped heart? The answer is tetralogy of Fallot. Very importantly, where do you see box-shaped heart? Box-shaped heart you see in a case of Epstein anomaly. So boot-shaped heart, tetralogy of Fallot, and box-shaped heart, Epstein anomaly. Flag sign. Flag sign is seen in which of the following condition? So 2F I had told you, flag sign and flaky paint dermatosis, they both are seen in a case of Kwashiorkor. Flag sign and flaky paint dermatosis, it is seen in Kwashiorkor. What is flag sign? So if you have a hair follicle, one part is shiny, one part is dull. One part is shiny, one part is dull. So this is known as a flag sign, like a dull shiny part of the hair follicle. A child is gasping with heart rate 70 beats per minute. If someone heart rate is 70 beats per minute, so means we all know if the heart rate is less than 100, we do bag and mask ventilation for 30 seconds. Bag and mask ventilation, which is also known as positive pressure ventilation, for 30 seconds. Weight quadruples by how many months? So we all know that weight doubles by 5 months, triples by 1 year, 4 times by 2 years, and 5 times by 3 years. Weight doubles by 5 months, triples by 1 year, 4 times by 2 years, and 5 times by 3 years. A pregnant female is receiving phenytoin during her first trimester. The drug may cause following problem. So if the mother has taken phenytoin during pregnancy, the baby can land up into fetal Hydantoin syndrome. And if you get a picture of fetal Hydantoin syndrome, so P for phenytoin, P for phalanx, उस बच्चे की उंगलियां नहीं बनी होंगी, digits, that in the picture the some problem with the digits, like a hypoplasia of the digits, some digits, fingers problem will be there in fetal Hydantoin syndrome. If the mother has taken alcohol during pregnancy, the baby can land up into fetal alcohol syndrome, where the patient has a smooth philtrum and thin upper lip. If the mother has not taken folic acid during pregnancy, the baby can land up into a neural tube defect. Well, if the mother has taken alcohol, this is if the mother has not taken folic acid. Okay, IUGR, if the mother is a case of uteroplacental insufficiency, she's suffering from anemia or preeclampsia or eclampsia, the baby can be a IUGR. And IUGR is intrauterine growth restriction, not retardation. Flag sign is due to deficiency of which of the following? So we all know flag sign, it is seen in a case of Kwashiorkor, and Kwashiorkor is nothing but deficiency of protein. Marasmus is deficiency of proteins and calories, whereas Kwashiorkor is deficiency of proteins. Where do you use Silverman-Anderson score? Silverman-Anderson score is used for which of the following disease? Silverman-Anderson score, yes, it is used for to assess the severity of distress in a newborn baby. In a preterm baby, basically we have the Silverman-Anderson score, where you have the upper chest retractions, lower chest retractions, xiphoid retractions, nasal flaring, and grunt. So these are the 5 points: upper chest retractions, lower chest retractions, xiphoid retractions, nasal flaring, and grunt. Okay, that you should know. Which of the following is the most teratogenic infection? Like teratogenic means during pregnancy. Zika virus, we have heard, it's not nice. Zika virus basically it cause what? It cause gray matter white matter calcification. It cause gray matter white matter calcification. Zika virus infection can cause in the baby gray matter white matter calcification. It will cause microcephaly and it will cause contractures. So microcephaly and contractures the baby can have if you have this Zika virus problem. So gray matter white matter calcifications, microcephaly and contractures. Okay, what is I donate in IKMC? KMC is kangaroo mother care. Previously it was intermittent kangaroo mother care, but now WHO says instead of intermittent we have immediate kangaroo mother care. So it's a update. Okay, in the previous videos I had told intermittent, but now the latest guidelines is immediate kangaroo mother care. An infant is diagnosed with Hirschsprung disease. With surgical intervention you want to do it. What happens in Hirschsprung disease? One part of the bowel is working perfectly, whereas another part of the bowel is totally flat because of the absence of the ganglion cells. And which procedure we do over here? We do over here is Duhamel procedure. Duhamel procedure. Fontaine operation or Norwood operation or Glenn operation. Fontaine, Norwood and Glenn is done in hypoplastic left heart syndrome, whereas Blalock-Taussig shunt, Watterson shunt and Port shunt, all these three procedures are done under tetralogy of Fallot. Your time is now. This life is so beautiful, guys. Problems will come. See, my life is like, if this is a I have to go to B. Okay, if this is a I have to go to B. सबकी ज़िंदगी हम कैसे चाहते हैं? बहुत हैप्पी चाहते हैं कि मैं A पे खड़ा हूँ, मुझे B पे जाना है. बहुत सिंपल सी लाइफ है, मेरा बड़ा क्लियर फंडा है, राइट? सो व्हाट हैपन्स वंस यू गो फ्रॉम A to B, चलते एक पेड़ आ गया. ठीक है, चलते एक पेड़ आ गया. अब दो नज़रिए हैं. या तो हम कोस सकते हैं कि ये साला पेड़ किसने रख दिया बीच में, ये पेड़ कहाँ से आ गया, मैं तो हमेशा से सीधी ज़िंदगी चाहता हूँ, ये पेड़ किसने रख दिया बीच में. आई ऑलवेज वॉन्ट अ वंडरफुल लाइफ, अ सिंपल लाइफ, आई डोंट डू बैड टू पीपल, हाउ कम अ ट्री केम इन बिटवीन. सो दो ऑप्शंस हैं. या तो पेड़ को मार के चल सकते हैं, या साइड में एक टर्न लेके ऐसे आके और फिर ऐसे चल सकते हैं. So either we can cut the tree or we can just take a side turn and go towards B. We can cut the tree, that's for sure. That's also a very valid option. But you will have 100 trees like this every day in your life. ऐसे 100 प्रकार के पेड़ आएंगे, तो 100 पेड़ को मारेंगे, तोड़ेंगे, काटेंगे, अपनी एनर्जी वेस्ट करेंगे. थोड़ा साइड होके निकलें, पेड़ को फूल बनाएं और फूल को फूक मार के उड़ा दें. So big hurdles, make them small, and small hurdles, just evacuate them, just leave them. So I was supposed to go from A to B. That was my thought, but the reality of life was I was supposed to start from A. I was supposed to walk, but a tree had to come. I had to understand the tree, and then I have to take a slight beautiful turn and then go to B. So this is life. तो ज़िंदगी में कभी भी अगर कोई प्रॉब्लम आ जाए ना, स्ट्रेस आ जाए, कोई किसी ने ताना मारा, कुछ भी हो, बस एक चीज़ अपने मन में बार बार बोलो, ये पेड़ कहाँ से आ गया, ये पेड़ कहाँ से आ गया. अच्छा, पेड़ आ गया, कोई बात नहीं. अब इस पेड़ को हल कैसे करना है, इस पेड़ से निकलना कैसे है. तो ज़िंदगी में जो हर्डल्स हैं वो पेड़ हैं. तो पेड़ को निकलते बस मन में ऐसे इमेजिनरी पिक्चर बनाइए, ये पेड़ कहाँ से आ गया, एंड बस जो पेड़ आ गया तो बस अब पेड़ से इधर से निकलेंगे या वहाँ से निकलेंगे. और अगले दिन वो पेड़ शायद दोबारा भी आ सकता है रास्ते में, तो उस पेड़ को फूल बना के निकलें, ताकि अगले दिन जब वो मिले तो वो पेड़ ना हो, वो फूल हो. ज़िंदगी बहुत बेटर हो जाएगी. All of the following signs are assessed under IMNCA guidelines except, so we have IMNCA guidelines for pneumonia, which has cough and all. We have fever, IMNCA guidelines. Ear problems, otitis media has a IMNCA guidelines. Development has no IMNCA guidelines. You remember the IMNCA guidelines of pneumonia, fast breathing with or without chest indrawing is known as pneumonia. If there are danger signs, that is known as severe pneumonia. If you remember, fast breathing with or without chest indrawing is known as pneumonia, for which we give home treatment, amoxicillin for 5 days. And for severe pneumonia, we admit the child and we give injection ampicillin and gentamicin. That is IMNCA guidelines for pneumonia. But development do not have any IMNCA guidelines. 6 साल का बच्चा है, डिफ़िकल्टी ब्रीदिंग हो रही है पीनट्स खाते खाते. What is the priority action in case of foreign body aspiration? 6-year-old is having difficulty breathing while eating peanuts. So something has gone down. So what is the action? So if the child was less than 1 year, I would have performed 5 back slaps, or slaps I would say 5 back thrust. Then I would have make the child supine. बच्चे को उल्टा करके 5 बार मारेंगे, फिर सीधा करके, अगर नहीं निकला है तो 5 5 बार चेस्ट कंप्रेशंस देंगे. Normally we'll start off with the 5 back slaps in the patient, and if still it's not happening, then definitely we'll go towards the, if still you're not able to what you called take out this thing, the foreign body, then we'll go towards this one, the other one, the 5 chest thrust. Okay, so and if the child is more than 1 year old, if the child is more than 1 year old, then we'll go do the Heimlich's maneuver. If the child is more than 1 year old, then we're gonna do Heimlich's maneuver. That you should know. Okay, so child more than 1 year old, Heimlich's maneuver. Less than 1 year old, 5. This is the option B. Well, this is a 6-year-old child, so we'll do Heimlich's maneuver. What is plus disease in a newborn and seen in which condition? In a case of retinopathy of prematurity, there is something known as ROP plus. So there we use actually this plus disease actually. A neonate has birth weight less than 2.5 kg. What do you call this? So less than 2.5 is low birth weight, less than 1.5 is very low birth weight, and less than 1 kg is extremely low birth weight. Which of the following is route for pentavalent vaccine? Penta, jo TT, all TT are given intramuscular. TTT as in hepatitis A, hepatitis B, DPT, Pentavac, Pentexim, and even anti-rabies serum also. Anti-rabies serum also is given intramuscular because anti-rabies vaccine is given intradermal. BCG is given intradermal, and MMR and chickenpox. MMR and chickenpox, they are given subcutaneous. MMR and chickenpox, they are given subcutaneous, and there is not even a single vaccine which is given intravenous. Which of the following is the age-independent anthropometry? Age-independent anthropometry, that is mid-upper arm circumference, because mid-upper arm circumference remains same from 6 months to 5 years. So 6 महीने का बच्चा हो या 5 साल का बच्चा हो, MUSC ले लो. It's a age-independent anthropometry. When palpating an abdomen of child with hypertrophic stenosis, the nursing officer found what? So we all know it's like a olive-shaped mass. In the olive-shaped mass in the upper right upper quadrant. So olive-shaped mass is something you have in CHPS. And what is the name of the surgery of CHPS? It is Ramstead pyloromyotomy. Ramstead pyloromyotomy is the name of the surgery. Ramstead pyloromyotomy is the name of the surgery for CHPS. During a prenatal visit, a nurse described fetal circulation consists of what? Okay, so we all know that umbilical cord basically has 2 artery and 1 vein. 2 artery and 1 vein. So 2 umbilical artery and 1 umbilical vein. So it's very simple. Yeah. So yeah, and we'll get this option changed. We'll make it 2 umbilical vein and 1 umbilical vein like that, because both option looks okay to me. So 2 umbilical artery and 1 umbilical vein, that is the right answer. Okay. Which of the following is not a sign of good attachment? What is good attachment? So number 1, chin touching the breast, mouth wide open. Baby's lower lip should be everted out. It should not be inverted. It should be everted out. So this is not a good sign of attachment. And mother's mother's lower areola inside the mouth, yeah, lower areola inside the mouth, yeah, as in they're trying to say lower areola is so lower areola is not exposed out, okay, which is a good thing, because upper areola should be exposed out. माँ का नीचे वाला areola दिखना ही नहीं चाहिए. So lower areola inside the mouth is good, fine option, but lower lip inverted, that's a wrong answer. Okay, that's it. So let's take a quick break. A very beautiful quote which says that every day is a chance to get better. Every beautiful day is a chance to get better. Don't waste it. जिंदगी भगवान की एक बहुत महंगी गिफ्ट है. बहुत रो के, इरिटेट होके, परेशान होके भी जिया जा सकता है, और बहुत बेहतरीन तरीके से भी जिया जा सकता है. So please take care and thank you.